This is part 4 of a series of lectures on antimicrobial resistance and antimicrobial stewardship in veterinary medicine. In this part, we'll be discussing antimicrobial stewardship, what it is, and how it's going to influence the future of veterinary medicine. So what is antimicrobial stewardship? Well, put at its simplest, it is essentially optimisation of the use of antimicrobials. And we do this to achieve the best clinical outcomes that are possible, to minimise adverse events for the patient, to limit selective pressures that can drive the emergence of resistance to antimicrobial drugs, and potentially to reduce excessive costs that might be attributable to suboptimal use of antimicrobial drugs. So some of the things that we should also consider when we're considering antimicrobial stewardship as an approach to our use of antimicrobials are some of the adjunct measures that can be implemented. These include making an accurate diagnosis of infectious diseases, utilising the best available control measures such as prophylaxis, biosecurity, hygiene, optimal animal management and care, and carefully considering the full range of selective pressures on antimicrobial resistance. And in this case, we need to be aware of the fact that it is not only resistance to antimicrobial drugs that we would normally administer therapeutically that is of concern, but also exposure to disinfectants and exposure to heavy metals that can also have a selective effect on antimicrobial resistance. So what does antimicrobial stewardship involve? Well, really it is a shared responsibility between veterinarians, diagnostic laboratories, clients, animal owners, animal managers and animal carers. We all share the responsibility for ensuring that we use antimicrobials optimally to achieve a clinically beneficial effect. And we really need to ensure that we achieve broad educational messages across all of these groups. So not only to our profession, but also to the laboratories that support us and particularly to our clients and other animal owners. So first of all, we need to consider why we use antimicrobials in domestic animals. We use them to enhance health, welfare and production from animals. We use them to treat diagnosed bacterial disease. We use them to prevent disease that we can predict is going to affect those animals at particular stages of their production cycle. We use them to attempt to treat undiagnosed disease, and in some instances they are used to improve production. The antimicrobials that are used differ considerably between the different animal species, the different production systems, and between veterinarians and farmers. The only data that we currently have available about this is the total amount of different antimicrobial drugs that are imported for agricultural purposes into Australia. The types of drugs that are used differ dramatically between food animals and companion animals, and that usage is influenced quite significantly by legislation, particularly in production animals, by routes of administration, by the pathogens that are being treated, and the different pharmacokinetics in the different animal species. And there are major differences in patterns of usage between the different animal species, and we need to consider all of these differences when we're attempting to try and achieve better use of the antimicrobial drugs that we have at our command. There are a number of things that we don't understand fully about the use of antimicrobial drugs, particularly in food animals. The timing and duration of therapy is likely to have a critical effect on the risk of development of antimicrobial resistance. And currently, the controls that we have in place on antimicrobial use in food animals are based on elimination of residues of the drug from the product that is likely to end up as food, rather than on the effect that that drug might have on development of resistance in the bacteria that are resident in the animal. We don't know whether concurrent administration of a drug to a large group of animals could have differing effects on the risk of development of resistance compared to administration to a single animal. But it seems likely that concurrent administration to a large group of animals may have a much greater effect on selection of resistance than administration to a single animal. And we also don't know whether administration in food and water poses a greater risk than administration by injection. Again, it seems likely that administration in food and water could have a much greater effect on the risk of development of resistance in gastrointestinal tract organisms than administration by injection, depending on the drug that we're talking about. And lastly, we don't know whether multiple different antimicrobials are used in the same animals over the course of their lifespan, because the use of multiple antimicrobials is more likely to select for multiple resistance than the use of a single antimicrobial. So if we're trying to control our usage of antimicrobial drugs and the effect this might have on the development of resistance in bacteria, we need to think about a number of things. We need to think about whether the effects of our administration of the drug, usage of the drug, has a long-term or a short-term effect on antimicrobial resistance. We need to know whether the use of this drug is likely to have an effect on the development of multiple resistance or just resistance to a single drug. We need to know whether this resistance that we may select for is transferable or whether it is only heritable within the bacterial species that's initially been selected for resistance. We need to know whether there's a potential risk for an environmental effect of the administration of that drug. And we need to know when we sample animals to determine whether there's been development of resistance, how that time of sampling relates to the treatment history of those animals so that we can fully interpret the effect that our therapy has had on the development of resistance. So what controls are there currently on antimicrobial usage in domestic animals? Well, this differs significantly depending on when the drug was first registered. There is much greater control on use in food animals and birds than there is in aquaculture, and our use in companion animals is much more commonly off-label. Our veterinary drug regulator is limited in its capacity to control the use of drugs and the registration of drugs based on the risk of resistance. There really needs to be some documented evidence of risk to human health before the regulator can impose restrictions. And it is very difficult to alter prior registration conditions. So what this really says is that although there are some written restrictions on labels for antimicrobial drugs, we really need to voluntarily impose additional restrictions on our usage of antimicrobial drugs. If we're trying to monitor for antimicrobial resistance and the effects that our antimicrobial use may have had on development of antimicrobial use, we need to think which organisms we might want to monitor. Commensal organisms are likely to be the reservoir of transferable resistance, and so they tend to be a focus of much of the monitoring. But we might also wish to focus on foodborne zoonotic pathogens, particularly in animals that we are ultimately using for food. We might want to focus on pathogens of domestic animals because these are the pathogens that are important in veterinary medicine, and the resistance in them is going to be important to our choices around antimicrobial therapy. We also need to think about when that surveillance should be conducted, particularly when it should be conducted in the life cycle of a particular production system.